The novel coronavirus is still raging in India and the total positive cases have crossed 4,90,000. The recovery rate is over 50% in India as well as globally. The direct fatality rate is comparatively low for Covid-19 than some of the previous pandemics. However, there is a big catch. Are Covid-19 survivors really fully recovered patients? The disease is new and there is no clear answer to this question. Even the earliest patients who recovered in China got reinfected only a few months ago. There is not enough data to analyze the long-term effects of Covid-19. This is where it becomes scarier. On June 14th, a nurse working in Atlanta, US posted a tweet saying, "When they say recovered, they don't tell you that it means you may need a lung transplant or that you may come back with a massive heart attack or stroke COVID makes." Simply, the nurse red flagged the long-term effects of Covid-19 on patients going home with a discharge slip from a hospital. Feeling relieved but without an inkling how their health condition may unfold in coming weeks and months due to the coronavirus infection they just survived. Standard Covid-19 protocol says an average patient recovers in 2 weeks and can be discharged. The WHO says critical cases can take up to 6 weeks for recovery. All recovered patients are advised home isolation for some time and report any new health condition immediately. There is not enough verifiable data to know what percentage of Covid-19 patients come back to hospitals with serious health conditions and recovery. But studies in many documents and elsewhere give enough of the glimpse of what may be the long-term effects of Covid-19. Reduced lung capacity. Studies have pointed to computerized tomography scans showing distinct changes in lungs of Covid-19 patients. Lungs of a healthy person appear black in CT scans. Those of Covid-19 patients show grey patches called ground glass opacities. These damages to lungs could be permanent, researchers suspect. Researchers found ground glass opacities in over 70% of Covid-19 patients. Another study in China established that such lung scarring is not limited to critically ill Covid-19 patients, but is seen even in asymptomatic patients. Those with mild symptoms also reported the same patches on their lungs. Weakened heart. COVID-19 essentially being a respiratory illness reduces oxygen levels in the body of serious patients. Low oxygen levels in the body increase pressure on heart. That a weakened heart is associated with COVID-19 had been seen even in patients in Wuhan, the early epicenter of coronavirus pandemic. About 20% of COVID-19 patients in Wuhan reported damage to heart, damage to brain and kidneys. The brain is overly dependent on an uninhibited supply of oxygen by blood vessels. What doctors have found in COVID-19 patients is that many develop blood clots, which can cause brain stroke. Stroke was not diagnosed only among the elderly COVID-19 patients but also in young adults. The clotting of blood can cause severe damage to other organs as well, such as lungs, heart, and kidneys. Among other possible long-term effects of COVID-19 on recovering patients include impact on neurocognitive ability, increased level of anxiety, and other psychological and mental health disorders. Some other studies have indicated infertility as post-COVID health condition and recommended urogenital tract monitoring among men having recovered from COVID-19.